Good day again. This is Dr. Frank Sutton for the American Pulmonary Medicine Institute. Welcome you back to this series. Last time we focused on some cardiovascular risk factors, vascular inflammation, and a method of beginning to cut back, to decrease your carbon monoxide levels, a method to start decreasing the inflammation in the body that smoking causes. Let me just review quickly. I told you that your central nervous system is a real bag of chemicals. I mean, tremendous number of chemicals are neurotransmitters that have to do with a sense of either enhanced thinking, concentration ability, or of pleasure or relaxation. And they go, I mean, there's serotonin, there's norepinephrine, there's acetylcholine. Acetylcholine actually is necessary for nerve transmission, and it's stimulated by nicotine. Glutamine, serotonin, a product called GABA, and dopamine. Dopamine is missing in Parkinson's disease. It's the chemical that is depleted, and it causes so many Parkinsonian symptoms. And you certainly don't want that depleted. But these are neurotransmitters: dopamine, norepinephrine, acetylcholine, glutamate. Their names are not important, but finally, there's one, beta endorphin, that I want to focus on. The endorphins are pleasure-producing things that, it's like maybe you grew up and you had an odor. On Saturday morning, men would come to my home and cut the grass, and I would awaken with freshly mown grass and hay odor coming in my window. It was so pleasant when I was a boy that that odor gives me a sense of pleasure. And maybe a scene, maybe a musical score, or a sunset that you see, or a picture that you have in your hall of a family reunion with someone that you love dearly, brings you a sense of pleasure. Well, beta endorphins are released with pleasure, and exercise, interestingly, releases these. So one of the things we suggest for cardiovascular health and lung health is that you pick up your activity level and develop an exercise program. Now today, there are many smart watches and smart phones, both watches and phones, that have programs to map your activity level, how many hours you've been standing, what your activity level's been like, how many calories you burned. Those are very handy for you. So I would recommend that you begin to try 15 to 20 minutes twice a day of increased activity, a minimum of 5 times a week. And while you're trying to stop every day, you need to do this. You need to occupy some of your time with exercise. Now, it doesn't have to be at a gym. It can be literally, as my wife does when the phone rings. One of the kids comes, she takes the phone and walks throughout the house while she's talking on the phone. She never sits down while she talks on the phone. See, that's just a great habit to have. She stays very active, and she uses those natural times during the day, like phone calls, to walk. And she doesn't walk at a slow pace. She really marches through the house, up the stairs to the upstairs, back down and around. And so simple things are very effective. But exercise releases endorphins. It increases lung health, cardiovascular health. And while you're decreasing your carbon monoxide levels and decreasing the mucus in your lungs and bringing your blood pressure down by less stimulant in your blood, this is a wonderful thing we encourage you to do. So, good hobbies, good exercise, good mental health. Now, what do I mean by that? If you're stressed, there are things that relax, and relaxation techniques that you can master in a very short period of time. Music naturally relaxes a lot of people. Now, not hard rock, but beautiful classical music scores. Music is indeed calms the beast within us, many people say, and so music can be helpful. Yoga and relaxation through yoga can be very helpful. Particularly the ladies that have time to go to a yoga class, will find that that's very valuable. But then I want to teach you and show you a technique that you can use, and it involves your breathing technique. And what I suggest you do is that you get somewhere where you can put your feet on the floor and you can sit back and relax with your feet flat, your arms supported, and where you can take some deep breaths, blow them out, and relax all over with your head relaxed and your eyes closed. Now, I do this with music. I take my phone, iPhone, and just put a little music on and just put it beside me. And I'll have 2 or 3 little pieces of classical music playing. And what you do is you take a slow breath in to your maximum volume over about 6 to 8 seconds, like this, just. And hold it at the top, hold it for 3, 2, 3, 4, and then relax. And then start back up. And hold it, 2, 3, 4, 5. Now, as you count slowly as you go up, and maybe you can just go up 1, 2, 3, 4, 5, 6. That may fill your lungs. I'm tall, have long lungs. I can take a slow breath over 8 seconds. You may take it up over 5 or 6 seconds. Doesn't matter. It's just the fact of you doing it slowly over time, stopping at the top, pausing, and then slowly letting it out. Now, what you'll notice if you take your pulse before and you record it, and then you do that for a full 5 minutes, and then record it, will guarantee you your pulse will always be down. And you will always have an increased skin temperature as a sign of dilatation. That's how your vessels dilate as you relax. It's very healthy. So relaxation techniques, being in relaxing settings, listening to relaxing music, performing relaxing exercise. Now, we do not recommend heavy exercise at bedtime, but light exercise right up till bedtime, stretching exercises, and a few sit-ups, a few pull-ups, a few push-ups. That's not heavy, and that's good for you. So these things, you're cutting back, you've developed a program, you're learning to relax, you've got a smoke-free environment you've created, you have some goals, and you're seeing success, and you're rewarding yourself. You're taking some of that. And speaking of rewarding, let me just give you some statistics. I have a little booklet here that I'll send you called "We're Ready to Help You." It's a little How to Quit book. And after 1 week, with current cigarette costs, you will save $42.21 after a week. After a month, you will have saved $181, $180.90. Might as well say $181. After a year, take a guess. $2,200, which if invested at 4 to 5%, you see where that's going. How about after 10 years? Well, obviously you just multiply that 1 year by 10, 22 grand. About a new Cadillac, new Lexus, new BMW. Of course, that'll just get you started. That'd be a nice down payment, wouldn't it? Or even a bass boat. Reward yourself, but you're going to save money. By the way, guess what else is decreasing? Your health care costs, your medical bills are decreasing. Your health insurance costs will go down. Not initially, but once they're confirmed that you're no longer a smoker, most people will lower the premium sum from the premiums you pay as an active smoker. And then life insurance costs definitely go down. You'll miss less days at work, and there's great benefit. So let's just see what happens to your body. Not only financially does this work, but I've already told you, 20 minutes after you stop, your heart rate drops. 12 hours after you quit, the carbon monoxide level has dropped to normal within 12 hours. Now it starts half an hour after you smoke your last cigarette, it starts down. 12 full hours, it's down. So if you were coming to see me as your physician and you had your last cigarette at 4 o'clock in the afternoon before you see me, and it's now 4 o'clock the next day, 24 hours later, and you tell me, "Doc, I hadn't had a cigarette since 4 yesterday afternoon," and I check your carbon monoxide level and it's sky high, I know you're fudging. You're not telling me the truth. You're not telling yourself the truth or me the truth. You'll be normal. You'll be down at what the ambient air is. And that's a great reinforcement for you, saying you have done it. You have decreased this thing that causes tremendous vascular disease, ties up your oxygen, and incites inflammation throughout your body. 1 to 9 months after quitting, your coughing will have just about disappeared, and the mucus will be out of your lungs, and we will note between 6 and 9 months an improvement in lung function. We will have measured it, and we will repeat it and see the improvement. 5 years after you quit, your stroke risk is reduced to that of a non-smoker, somewhere between 5 and 8 years after you quit. 15 years after you quit, your risk of coronary heart disease is back to that of a non-smoker. Now, it takes 15 years. It takes 10 to 15 years to get your cancer risk as low as it'll go. And remember, I told you, it never goes to zero, but it improves. So I hope this is helpful to you. There's financial benefit, tremendous health benefit. It starts immediately and it continues for years. You're going to feel better. You're going to look better. You're going to have less wrinkles. You're not going to have a hairy tongue. You're not going to have white plaques over your lips. Your clothes are not going to smell. You're not going to stink. You're not going to be objectionable when you walk in a room from being super saturated with smoke that non-smokers pick up from across the room. So here's to your health. I want to encourage you. And in our last session next time, I'll see you. We'll wind up, and I'll tell you again about the package we can send you and about our final instruction for you becoming a successful non-smoker. Here's to your health from American Pulmonary Medicine Institute.